Hello, and welcome to Dr. Mercola's Cellular Wisdom, the podcast where we peel back the layers of natural health, one slightly baffled look at a time. I'm Ethan Foster, your resident connoisseur of questionable side-eye, forever intrigued by the oddities of human behavior.
And I'm Alara Sky, the unstoppable engine of sass and science, ready to break down the biggest health mysteries with a dash of wit. Between your perplexed glances and my lightning-quick retorts, we might just stumble upon a revolutionary health insight or two.
That's a lofty ambition, Alara. You sure we can manage both comedy and science in the same breath?
We'll handle it elegantly, much like wearing sneakers with a ball gown, unconventional but surprisingly comfortable. And if anything, we'll at least entertain people for a solid half hour while they sip their herbal tea.
Let's set the stage. Today we're diving into a topic that often sends people scurrying to the doctor's office: UTIs, or urinary tract infections. According to Dr. Mercola, or as I like to refer to him, the man with the perpetual microscope, UTIs are notoriously misdiagnosed.
Correct. And this misdiagnosis is like giving your dog a bath when all he really needed was a pat on the head. Sure, the dog is clean, but that bath might have been overkill. In the medical sense, that translates to a huge problem. Too many antibiotics being prescribed when they're not necessary.
Antibiotics, the modern wonder drugs that used to feel like silver bullets. Now, we're learning the bullets might just be traveling in all the wrong directions, hitting healthy bacteria and leading us down a path of resistance. Dr. Mercola points out that UTIs are a prime culprit for antibiotic overuse.
He's not mincing words. We have data from JAMA Network Open suggesting that 15% of all antibiotic prescriptions in the US come from UTI treatments. That's a lot of pills. I can't help but picture a giant mound of antibiotic bottles stacked up like a wobbly tower in a pharmacy warehouse.
And it's a tower that topples easily if we're not careful. Overprescription doesn't just strain our wallets, it fuels antibiotic resistance. Suddenly, that routine antibiotic for the next bacterial infection might not work. Then we're in a pickle, except this pickle is less tangy and more of a harbinger of doom.
That might be the darkest description of a pickle I've ever heard. But you're right. Dr. Mercola references a study in the U.S. military health system that found guidelines for treating uncomplicated UTIs were 91% concordant. That means they were following recommended practices well in many cases. But there's still significant variation. Some specialties, such as obstetrics and gynecology, are less inclined towards certain guidelines, though ironically, they also have lower rates of overprescription. Meanwhile, emergency medicine seems to hand out antibiotics as if they're going out of style.
It's a complex puzzle. People show up in the ER with all kinds of symptoms, and doctors might feel compelled to act fast. But if they're not verifying a real UTI is present, that antibiotic is just a shot in the dark. According to the data, it looks like many doctors are shooting in that dark a little too often.
True, and that's alarming. Dr. Mercola notes that a large chunk of patients, especially older folks, get labeled with a UTI simply because of mental status changes. It's like your sweet Aunt Beatrice is suddenly a bit confused, so they jump to UTI and whip out the antibiotic prescription pad.
Happens all the time. The data mentioned that in emergency room settings, a huge number of patients were dosed with antibiotics for UTIs they didn't even have. It's almost as if the confusion triggered an antibiotic reflex. You're acting loopy, here's a pill. Meanwhile, the actual cause might be something entirely different.
Exactly. And don't forget the role E. Coli plays. This is the main bacterial villain behind UTIs, and Dr. Mercola points out that much of it comes from contaminated food sources, particularly CAFO chicken. It's like the sneakiest game of tag. Your dinner might tag you with E. coli and suddenly you're it, running to find relief.
Now, I know you and your jokes can run a little wild, but I have to ask the practical question. If CAFO chicken is contributing to E. coli UTIs, what's the solution?
Well, doctor, Mercola suggests ditching the CAFO meats altogether. It's not just chicken, but also pork and beef from concentrated animal feeding operations. These places often use heavy doses of antibiotics on the animals, fueling a cycle where the bacteria become resistant. It's like they're training in a bacterial boot camp.
Goodness, the image of a bacterial boot camp is both fascinating and horrifying. Little microbes doing push-ups chanting, "We are unstoppable."
Precisely. That's why, if you must eat meat, go for organic, grass-fed options or from regenerative farms. Dr. Mercola also warns about high linoleic acid in chicken, which can be an entirely different health headache. But that's another story.
So it's wise to be choosy about your protein sources. Makes sense. Let's talk about what else Dr. Mercola says we can do to prevent UTIs. There's mention of methylene blue, cranberries, hydration.
Indeed, it's a trifecta of new school, old school, and fundamental. Methylene blue is sort of a modern approach. It's a dye that can get excreted in the urine, apparently helping to kill off bacteria in the bladder. Cranberries, on the other hand, are the grandmother-approved approach that keeps bacteria from sticking to the urinary tract.
So, methylene blue is the laser-shooting vigilante, and cranberries are like a polite but firm bouncer that refuses to let the bacteria slip inside.
That's not a bad analogy. Though if you've ever taken methylene blue, you'll notice your urine turning a different color, which can be a bit disconcerting until you remember, oh right, I've got a personal disco going on in there.
It's definitely a conversation starter if you're not prepared. And then there's the evergreen advice about hygiene. Drink plenty of water, wipe front to back, consider using a bidet, and if you're going to get cozy with someone, keep things clean before and after. These steps are as old as time, but we sometimes forget them.
Right. It all comes down to common sense. Unfortunately, common sense in health is like the lost city of Atlantis. People talk about it, but no one's entirely sure where it went.
Another angle Dr. Mercola discusses is the importance of sun exposure, especially if you've cut out seed oils. Something about preventing the oxidation of linoleic acid in the skin. The gist is that if you've been marinating in seed oils, your skin is more prone to damage under intense UV. Once you rid your body of those oils, the sun can actually help optimize your health.
It's a twist on the old, get some sunshine advice, but with the nuance that you don't want to deep fry yourself in your own oils. Detoxing from seed oils might take months, so in the meantime, the best approach is moderate sun exposure during non-peak hours or sometime after your diet has been cleaned up.
Speaking of cleaning up, Dr. Mercola puts a big emphasis on eliminating processed foods to reduce your overall inflammatory burden. And also, since we're on the subject of nether regions, we might as well champion better lifestyle practices to lessen the risk of UTIs. The less we rely on antibiotics, the better we'll be in the long run.
Precisely. When we overuse antibiotics, it's like using a jackhammer to remove a single weed from your garden. Sure, that weed is gone, but so are half your rose bushes. Then the entire neighborhood complains about the noise and your yard is cratered. Meanwhile, the next weed that crops up might come armed with heavy weaponry.
That's the antibiotic resistance scenario in a nutshell. Bacteria learn fast, and once they develop resistance, we're left scrambling to find something else to combat them. Then the cycle continues. It's a precarious spot, especially for people who truly need antibiotic treatments for severe infections.
Now, some doctors might balk at the mention of alternative strategies like methylene blue, but Dr. Mercola insists it's an effective agent in the bladder, especially when you're dealing with UTIs. He underscores, though, that quality matters. We're not talking about rummaging through an art supply store for random dyes.
No finger painting with methylene blue. Got it. He also highlights that cranberries can help, but they won't do much good if the rest of your lifestyle is a bacterial smorgasbord. Meaning, if you're consistently munching on CAFO chicken and ignoring basic hygiene, don't expect cranberries to be a magic bullet.
Magic bullet? That's what got us here in the first place. Jokes aside, it's about synergy, dietary changes, mindful hygiene, possibly using targeted supplements like methylene blue, and being judicious about antibiotics. When you combine all these factors, you drastically lower your chance of developing a UTI.
And if that means passing on certain questionable fast food items that might be harboring antibiotic-resistant E. coli, it's a small price to pay for fewer trips to the doctor. Not to mention, your digestive system will likely thank you.
Dr. Mercola also points out that over half the urine cultures in some settings come back negative. That means a lot of people given antibiotics never even had a confirmed UTI. So the UTI label can be slapped on someone who shows up in the ER with confusion or general malaise, and the test results are almost an afterthought.
It's like diagnosing someone with a broken leg before they've even had an X-ray. Then they're limping around in a cast for no good reason, wondering why it itches so much. Meanwhile, the real problem goes unaddressed.
Exactly. And that's where antibiotic stewardship becomes essential. We don't want to turn the ER into an antibiotic buffet. We want them reserved for legitimate cases where they're needed. In the big picture, that helps us keep effective antibiotics around for future generations.
The future. That's something we rarely think about when we're sick in the moment. But imagine a world where a simple bacterial infection is nearly impossible to treat because we obliterated the efficacy of our best medicines.
Yikes, that's bleak. But let's steer back to the hopeful side. There are solutions here. Clean up your diet, choose better protein sources, use natural methods to keep your urinary tract healthy, and only rely on antibiotics when you truly need them. We can drastically cut down UTI risks without fueling the antibiotic resistance train.
That does sound hopeful. So, to recap, UTIs often come from E. coli, many times sourced from contaminated CAFO meat. Then there's the tendency to diagnose UTIs haphazardly, especially in emergency settings where doctors see confusion or other non-specific symptoms and reflexively reach for antibiotics.
Yes, and we have the unfortunate reality that many of those prescriptions are unnecessary, which then contributes to antibiotic resistance. Meanwhile, if you really do have a UTI, natural strategies like methylene blue, cranberries, hygiene measures, and dietary changes can make a huge difference.
It's a simple list, but implementing it consistently can be a challenge. People love their convenience foods, and after a busy day, it can be tempting to pick up a few questionable items for dinner. But hey, your bladder might call you out on it later.
And trust me, your bladder doesn't have a polite voice. It sends some fairly urgent signals when it's unhappy, such as the dreaded burning sensation. Better to be proactive.
So says the voice of experience?
I will neither confirm nor deny. But let's put it this way. After hearing how easily UTIs can spiral into antibiotic overuse, I'd rather be cautious and mindful. No one enjoys frantic trips to the restroom or dealing with a war zone in their urinary tract.
Amen to that. One final point Dr. Mercola makes is about supporting overall cellular energy. By reducing harmful fats like seed oils, engaging in moderate sun exposure, and grounding yourself, like walking barefoot on the beach, you boost your cell's resilience. That means your body is better prepared to fend off infections in general.
It's almost like building an internal fortress. The more robust your natural defense is, the less likely a little bacterial scout can breach your gates. That's the essence of natural health, creating conditions where our bodies can do what they were designed to do, which is to stay balanced and fight off invaders.
Indeed. And the reward for that mindful living is fewer doctor visits, fewer antibiotic prescriptions, and a happier microbiome. Everyone wins, except maybe the antibiotic companies.
I don't think they'll suffer too much. They can put their energy into developing new, more targeted treatments. Meanwhile, we can restore some sanity to our daily lives and support those around us in making healthier decisions.
That's a nice note to end on, Alara. Before we wrap up, let's just reiterate. UTIs are real and potentially serious, but diagnosing them needs more care. If you suspect one, make sure to confirm it. Then, if you do have a UTI, weigh those treatment options carefully. And if you don't, rejoice that you can keep your gut flora intact.
Well said, Mr. Observational Humor. That's it for today's installment of Dr. Mercola's Cellular Wisdom. Remember, you have the power to make choices that protect your health and reduce our reliance on antibiotics. Eat clean, stay hydrated, consider helpful tools like Methylene Blue and Cranberries, and think twice before defaulting to the antibiotic route.
Wise words. Thanks for joining us, folks. I'm Ethan Foster, reminding you that sometimes less is more, especially when it comes to antibiotics.
And I'm Alara Sky, echoing that we should always question our assumptions and our dinner choices. Stay curious, stay healthy, and we'll see you next time on Dr. Mercola's Cellular Wisdom.